What are dental cavitations and what could we do about them?
Jerry, since you're more of an expert in that area, I can recognize them, but you've done more research on that.
Yeah, no, for sure. So
free.
dental cavitations are by the way, it's a made-up word. So it was coined by an orthopedic surgeon in 1931. He came up with a word for a hole in the jaw, very commonly in areas where third molar teeth, wisdom teeth, were pulled. Extracted. We like to say extracted. And we used to think the bone just automatically heals like this. And now we know that bone regeneration needs to be promoted and supported with a graft or a scaffold for the bone to anastomose and regenerate. So a lot of people have their wisdom teeth extracted. They never have these areas treated properly after the extraction. And they form these holes in the jaw. They are a source of chronic inflammation, and they are like petri dishes for pathogens. So we see everything from Lyme spirochetes, candida, mold, parasites, all kinds of the heavy metals that can accumulate in these dead areas of bone where the patient does not report fever, pain, or swelling. So, and what's interesting, it seems like everybody has them these days. It's because we're able to see them with the newer technology like CBCT, which is a 3D look at.
Which is so great. And I remember Boyd Haley speaking so much about these. And he said, they've never found one that doesn't have a sludge of toxins and heavy metal in them. It's just like it's a black hole nothing can escape from in the body. So in a sense, maybe that's a good way to detoxify the body if you do have one cavitation, but it doesn't seem to just stay there by itself. But he always said they're just nasty.
Yeah. And, energetically, these third molar areas, there are meridians throughout the body. And we know there are meridians from teeth to every part of the body. But what's interesting is the cavitations that are most common in the areas where the wisdom teeth were removed. And by the way, anyone who's had a wisdom tooth removed should have a CBCT. And the only other problem is not just getting the CBCT, but having someone experienced to read it. We do virtual consults to read these all the time, and I'm happy to do that. And we can put up a link for that. But the CBCT is really the gold standard for being able to see these lesions in the jaw, in the third molar areas where teeth may have been extracted.
And if there is something wrong, what do you do if you have a cavitation that has sludge in it or something? What do you do?
Well, there's a protocol to treat it, and I created a surgical protocol using an erbium laser. Okay. The second thing, many dentists used a dental drill, which generates heat and friction to drill into the jaw, into the hole, which I always found, a little barbaric. And so I had been working with erbium lasers for alveolar bone around periodontally teeth that had gum disease. And we reapplied that to using them to access the hole with as little trauma to the body as possible. The second thing we do is, I always take a sample of what's in there because I like to know what bugs are in there. And so we do a pathology sample, but then we disinfect it. And how do we disinfect it? Ozone is very effective. I love ozone because ozone not only disinfects, but it also draws blood. So we want to get blood because when bone is necrotic, what we call cavitational osteonecrosis or jaw osteonecrosis, JON, when the bone is dead, it doesn't have a good blood supply. So we want to get blood because that's how your immune system can work effectively in these areas and also help bring the cells that regenerate bone, the osteoblasts, to work. So another thing that we do in addition to disinfecting is the third thing, which is stimulate what we call mitotic division of the osteoblast. In English, that means get the cells that make new bone to divide. And so we grow bone back, and we help foster the body's regeneration of bone in these areas where there was a dead hole. So get in there without trauma, clean it out thoroughly, get the bone to regenerate, get the lesion to heal.
Great, thank you.
Now, Jerry, what are you using to get the bone to regenerate?
Oh, so that's thank you. So we use we draw blood and use a part of the blood, platelet-rich fibrin, so it's PRF.
Okay, PRF.
And then we also, I use a bone mineral in addition. In large lesions, you really need a bone mineral because the platelet-rich fibrin will break down too fast for the bone to have a chance to fully regenerate. So we get relapses if you don't use a bone graft with that.
Oh, that's brilliant. And so, yeah, you have it's a scaffolding essentially.
Yes. Yes.
Okay.
So what people should understand is the material that we put in there, most of it, which is biologic from your own body, it's kind of a scaffolding on a building as they're, replacing the bricks on the facade of a building. Then the scaffold comes down and the new brick is there. That's kind of what we do in the cavitation sites so that the body can regenerate.
Got it.
Well, Jerry, why don't you just come down to my office in California and
Where
we'll
are you?
hang out and have a good time, and we'll help save lives all day long. It's warmer here too.
I know. Where are you? Where are you, Paul?
I'm in Encino, California, just
Oh,
outside
beautiful,
of
beautiful.
Burbank and Beverly Hills.
Absolutely. Well, I'm glad Steve brought us together. Steve, I know
Yeah,
you
right.
have a lot of questions, so keep
Yep.
going.
Okay, just quickly, is there anything to say about braces? Should children just go to an orthodontist, get braces? Are there pros and cons? Is this like, everything's fine, or is there something that we need to know about this if we have children and they're told they need braces?
I'll jump in on it for a second, and then Jerry, let me know your thoughts. I think it's important to find an orthodontist that is working with the development of the jaw as the child is growing, and also is taking into account the airway. So there's a way that they can check the airway space. They can make sure that they're rounding out, expanding the upper palate or jawbone and the lower jawbone, especially at an early age. If they do that, basically what they're attempting to do is try to create a jaw that's similar to what our ancestors had before we introduced sugar to our worldwide distribution center that began to create overbites, underbites, and crossbites based on the research of West and Price. So an orthodontist that can expand and create this expansion, I think, is very, very helpful for the development of the child, short-term and long-term. And generally they do it through expansion. Years ago when I would have orthodontics in my age group, they would pull the middle teeth and pull everything back. Well, that just jammed everything back. So it could affect the airway. So you have more people with sleep apnea, dyspnea, problems like that can be completely prevented and avoided early on.
Yeah, I couldn't agree with Paul. He basically said exactly what I was going to do. Too many orthodontists of the past were focused on getting the teeth straight, and sometimes they did extraction therapy, and that's like shrinking the cage. And we have a colleague, Felix Liao, wrote a book, 6 Foot Tiger, 3 Foot Cage. The 6 Foot tiger is your tongue, and the 3 Foot cage is your mouth, especially after orthodontics, where they shrink the cage because they pull teeth to, quote unquote, make room for the teeth to look pretty and straight. What they really should be looking on is exactly what Paul said, which is expansion, so that teeth have room and the airway is protected and enhanced. So
Right.
guiding the growth of the jaw in orthodontics is more important than just moving teeth around so they look pretty and straight. The airway and the adaptation of the maxilla, the upper jaw and the lower jaw, the mandible. The other thing I totally agree with Paul about sugar is I'm a huge proponent of Weston Price and of his work. I think there should be a statue of him in front of the American Dental Association.
Agreed.
Research on the ADA that this man was talking about the fact that more civilized diets which were higher in refined carbohydrates and sugars, actually led to deformities in the jaw and damaging the genes and the expression of those genes in subsequent generations. He was talking about this in the early 1900s. He was talking about epigenetics, which is a very hot topic today.
Right.
Okay.
Yeah, and he showed, right, that, I mean, he did the experiments with rabbits. He'd feed them a high sugar fructose diet, and he would see within 3 generations, the rabbits started developing cross bites, underbites, crowded teeth, malformed arches, etc. So that's a tough pill to swallow, that what you're doing today can, malform your great grandchildren. But there seems to be good evidence and support, because the fossil findings show nice, robust, round arch forms, potentially open airways as a result. And it would put orthodontists out of business within 3 generations, but I don't know that that's going to happen that fast, sadly.
What do you do to help people who grind their teeth at night? What's the problem with grinding your teeth, and how do you prevent it?
Well, all right, I'll go first this time.
Yeah.
Grinding teeth, again, is a symptom. Okay. And very often it's a symptom. And so what do you want to do? Do you want to, and this is the thing about how Paul and I look at dentistry, is we go for the root cause, right?
Yeah.
What is driving that clenching and grinding? Believe it or not, many times, including temporal mandibular joint disorder, many times it's the airway. It's the area. People are clenching and grinding, and of course stress can fuel that. It's a parafunctional habit, but a lot of times when sleep apnea is not snoring, even though snoring is a symptom, there are many people who have sleep apnea who don't snore at all. There's about 1 billion people on the planet suffering from obstructive sleep apnea. Great majority of those cases have to do with the airway right in your mouth. And the tongue is like the rubber stopper in the neck of a wine bottle. So if they have a compromised airway and they have apneic episodes where they stop breathing, the brain goes crazy. It triggers a lot of clenching, grinding, and all kinds of behaviors, because it's like you're suffocating in your sleep. Another thing it's linked to is bedwetting in children. And adults just have to get up and go to the bathroom all the time. So everyone should get a CBCT. Everyone should get a home sleep study. It's a great diagnostic tool to see if you have it.
And
I agree with Jerry on that. And, interestingly enough, it's the $8 billion question. Why do I grind my teeth, doctor? And everybody, so when we don't know what the answer is, we always say it's stress, of course.
Right.
Because, we have to give some answer. But the truth is, we don't fully know completely, but I suspect it's a genetic type of response, again, to people are having a difficulty catching their breath. It helps them open their airway, and they just can't shut it off. And so they keep rubbing and grinding their teeth. But I have this other hypothesis, Jerry, and I think somehow it stimulates cerebral spinal fluid so that it keeps floating through. I can't seem to find any research on that, but it just seems to make sense to me. And
it's a very interesting hypothesis, and it makes sense.
Yeah.
Are there any devices we should use if we're grinding our teeth?
I think you have to get to the root cause and then decide what device to use.